If you've been experiencing pain on the outer side of your hip that sometimes radiates down into the groin or even into the back, you might have a really tight gluteus medius. It's one of the main external hip rotators on the outside of your pelvis. And so in this video, we're going to show you one simple strategy using a foam roller on how to relieve that tension and improve performance. My name is Dr. Jordan Fairley, and every single day I help people get out of pain, improve balance and ease in their body through chiropractic care. And what I notice is that if there's any sort of rotation or unleveling of the pelvis, you're going to have certain areas of compensation in your hips. So some areas are going to get tensioned, other areas are going to get compressed, and over time your body is going to respond to that type of unleveling. And so being able to release those tight glute medius fibers can really help not only create ease in your pelvis, complement the chiropractic adjustment, but also help you get out of pain. All right, so in order to roll out our gluteus medius, you're going to need a foam roller and somewhere to foam roll. So the gluteus medius, again, is one of the main hip stabilizers, and it's right above your hip bone. So where your femur comes up and inserts into the iliac crest or the socket of your pelvis, right there above that area is going to be your gluteus medius, and it attaches to the iliac crest. So you might have pain here, here, or back here. Anywhere and everywhere you feel like you can break up some of that tight muscle tissue and those tight myofascial fibers, this is going to be beneficial for you. So let's grab our foam roller, put it on the ground. In order to isolate this muscle, I like to put one leg underneath the other leg. So I'll do it like this, in this position, one leg bent, the other leg straight, and again, right above the hip bone is where the gluteus medius is. I want to make sure I'm stabilizing my spine so I'm not injuring myself as I'm trying to help relieve myself. So by doing this, I'm going to take a huge breath of expansion. Hold that breath in, that intra-abdominal pressure as I do this movement, and then from here I can lift and roll right above that hip bone here. You can find different fibers that might be really tight or tender and just allow yourself to put pressure down onto it, breaking up some of the tight tissue fibers. If you want to get even more into this, you can lift the involved leg up and down, which will really help activate that glute med. And so you're applying pressure, breaking up those tissues as you're utilizing that muscle group. And then another thing that I really like to do is what I call a pin and stretch. So I'm finding an area that's really tight. Oh, right there, I feel that. I'm gonna hold that and then utilize this muscle group by then bending my knee and straightening my leg and lifting. Bend, straight, and lift. And as I do that, I'm pinning the tight fibers and then allowing those muscle fibers to lengthen underneath this spot. Again, creating intra-abdominal pressure the entire time, allowing my body to sink into this part and rolling through it to help break up my gluteus medius. I hope you enjoyed this video for how to properly roll out your glute med. If you have any questions or concerns, please leave them in a comment box below. Again, if you're having glute med pain on both sides, it might be because of how you are sitting or your pelvis being rotated in on that back side. If you're having it just on one side, you might be having some sort of unleveling, rotation, or fixation within your pelvis, causing different compensation patterns over time. But by being able to roll out those tight muscle groups, you'll be able to help get rid of those compensations so that then you can treat the root cause. Again, I'm Dr. Jordan Fairley. I hope this video is beneficial for you. I'll see you next time.